service to our country. Mr. Chairman, I continue to be impressed by the bottomless reservoirs of counterfeit outrage and self-righteousness summed up by the president's defenders who are complaining over absolute nonsense like imaginary hoaxes, imaginary constitutional offenses, and of course the imaginary repression of the president's quack miracle cures, which have been proven to be a danger to our people. But let's return back to reality. Let's come back to America, where our people are suffering. According to the New York Times, new cases are up 80% in the last 2 weeks. We're seeing a startling rise in coronavirus cases in many of our southern and western states, including Florida, Texas, Arkansas, Alabama, Arizona, Oklahoma, and many others. 35 states where the virus is now on the rise. Yesterday, the United States shattered all records with new cases reported in a single day reaching nearly 50,000. There were more than 800,000 new cases reported in June alone, and Dr. Fauci says we are on course to hit 100,000 cases per day. That is terrifying. Now, since the pandemic began, the Trump administration has insisted upon having no plan. It's up to the states. It's helter-skelter ragtag operation. The Trump administration has made only limited and sporadic use of the Defense Production Act and has mostly relied on the private sector to procure supplies, often from China and other foreign suppliers, and the same foreign suppliers to be distributing the supplies. And we know President Trump, contrary to all this mad scramble to try to distance him from China, we know that President Trump praised the performance of the Chinese government and President Xi 37 different times in January, February, March, and April, praising General Xi's good, very good, great performance, his relationship with them, the extraordinary deals they are working together. And if our Republicans want to go down that road instead of working to address the needs of the people, I'm very happy to do it because it will lead into total disgrace and embarrassment of their arguments and their attempts to blame China for this whole situation. And if China covered up at the beginning, which I think it did, President Trump covered up for China in the process. That's the relationship. Now, Rear Admiral Polubchik, I wanted to ask you questions about demand and supply. You said that the demand for masks may be inflated because some industries think that they need them when they don't actually need them. And I want to make sure I heard you right there. I think you invoked janitorial services as one of those. Do janitors and custodial crews, like the ones that are going to clean the Rayburn the House office building this evening, do they not need masks?
Sure, there's several standards of masks, right? So I was referring to medical grade. Those would be covered under NIOSH. And so there are different standard of masks. So I'm not saying that they don't need a mask. I'm just saying there's different standards of masks.
Okay, so let me go to the question of supply then. And this goes to the question I think Ms. Waters was asking you. You said that you're not certain about what the nationwide supply of PPEs is, and that might be understated, because you don't know how much PPP and how many masks the states are actually in possession of. Can you just explain why you don't have that figure, why you don't know that, and will we ever come to a place where we actually have a coordinated national strategy to get Americans the equipment that they need?
Sir, there is a coordinated national strategy. And so the states are working with me to give me their warehouse information data as we work through this. And if you'd heard any of my other answers, the supply chain information, you can't run a supply chain without information, without data. So the first thing I did was I brought in all the business systems for 90% of the healthcare supply chain. So I've aggregated that at FEMA in a data lake, brought in a information tool from DOD, and I can see where.
Forgive me, because my
right, sir. So it's all part of the answer. And so we're adding the state warehouses, adding the hospital information. And so Health and Human Services and FEMA are going to have the entire ecosystem of understanding supply and demand across the nation.
Okay, and finally, given the explosive demand for PPE right now because of a pandemic out of control, should we not be using the Defense Production Act more comprehensively and expansively right now to increase the supply for the crisis that's coming?
So Mr. Fahey may be able to comment on this, but there are multiple areas under development to expand production, whether it be pharmaceuticals, whether it be more cloth and non-woven fabric for surgical masks, whether it be other nitrile gloves, et cetera. So all of those take time and investment decision criteria, but Mr. Fahey may be able to answer the question about the robustness of that answer.
Can you answer? And I'll yield back after that, Mr. Chairman.
Yes, sir. We have many efforts going on. As the Admiral talked about, I mean, we think we're pretty good on the medical mask perspective, but in every other category, the process goes that we have an extensive process where we go out and we ask industry what they're willing to do and making sure they understand our requirements. And for the other pieces of the equipment, we've done it a lot on masks, we've done it on ventilators. The other thing we don't mention a lot is a lot of times the supply chain is bottleneck is as a subcontractor. So we're looking at the subcontract. So we have efforts in every line of effort from a PPE and medical equipment to expand the domestic capacity here in the U.S.
Thank you very much. The gentleman's time has expired. The chair now recognizes Mr. Kim.